This short video explains what the Connected Communities project is and how you can take part if you want to. The video can be paused, muted, or watched again to help you understand the content. But please tell us if you need this information in a different language to English, and we'll try to provide it. Hi, my name's Jo Weldon. I'm a researcher who works at the University of Central Lancashire on a project for the National Institute for Health and Care Research. I'm working with some other researchers who you might meet, Catherine Berzens and Danielle Christian. This is a research project about local support services that use people known as signposters. Signposters link people up with different kinds of help and activities in the community where they live, and we're calling this type of work person-centred, community-based support services. These local services guide people to find support and activities in their community, and it happens in the following way. Someone's referred to a service or refers themselves there. A signposter talks with them to find out what kind of help they want or what activities they want to do. And then the signposter helps them to access those kinds of community-based support. We want to find out if the way these services are set up is helpful or not by talking to two groups of people who use the service to find local support in their community and people who work for the service in some way for their job. We'd like to talk to you about what it was like for you to get help or work with this service. One of our researchers will talk to you for up to an hour about what you think works well and not so well about the way the support service you were involved with is run. At the end of the project, we'll produce advice about how these services work best. This will help other people set up similar services in other places. We can talk to you about the service whenever it's convenient for you. The researcher will offer you a choice of dates and times. You can also choose where the discussion takes place. We could talk over the phone or through a video conferencing web link. This would be through Microsoft Teams, and you won't need to install any new software. Or if you'd like to speak to us face-to-face, we can meet you in a private space at your local service. We'll record your agreement to take part. This is known as consent before our discussion. And to do this, you'll be read some statements aloud, and we'll ask you to answer yes or no to each of them. And this can be done on a written document too, where you'd write your initials instead of saying yes. The good things about taking part are you'll have a chance to share your thoughts about how you felt about using your local support service, and if the COVID-19 pandemic affected your involvement with that service at all. You'll also be able to help us understand how these services work best. This information will be used to help other people set up similar services in different communities. If you're a service user, rather than someone who works with the service for their job, we'll offer you a £25 gift voucher for giving us an hour of your time. It's your choice to accept, but if you already receive any state benefits, you might want to check with your benefits advisor that receiving this won't affect your future benefit payments. The bad things about taking part might be the discussion will mean speaking with one of our researchers for up to an hour. You might find some questions difficult to answer, but we can help you with this by asking them in different ways. It's also okay if there's any questions that you just don't want to answer, or if you want to tell us to stop the discussion, and you won't need to give us a reason for not answering or stopping. If you choose to speak to us face-to-face, we'll arrange to meet you in an airy space to reduce the risk of COVID-19. We'll also encourage using a mask or a face covering and social distancing if you feel comfortable. You can say no if you don't want to talk to us, and it won't affect how you're treated, either now or in the future. It's also okay to change your mind. For example, if you say yes to a discussion with us, but decide later that you don't want to be a part of the research. In this research study, we will use your information, but we'll only use information that we need for the research. You won't need to share any personal information with us when we talk. We'll make a recording of the discussion, and this helps us to make sure that we don't miss any of the important things that you tell us. We will let very few people know your name or contact details, and only if they really need it for this study. Everyone involved in this study will keep your data safe and secure, and will also follow all privacy rules. If you share information with us which gives the impression that you or other people could be in some kind of danger, we might need to tell someone. But if this happens, we will try to talk to you about this before telling anyone else. No one outside of the research team will hear your recording. After we've written down what you tell us, we'll destroy that recording. We'll remove your name from the recording and make sure no one can tell who you are from the reports we write. And these written records of discussions are called transcripts, and you can ask for a copy of your transcript if you want it. After the study ends, we'll save some information in case we need to check it, and we'll also use some of the information we collect from talking to people to write a report, a guide to help other services, and share it at conferences and on a project website. You can receive a copy of the project results and publications if you want, once they're available. It's your choice to take part if you want to, and you can take some time to think about this or speak to other people about it to help you decide. And it's fine if you've got any questions about the research or want to talk about it with us before making your decision. To do this, you can email me at jcweldon@uclan.ac.uk or by calling my phone number 01772 894959. This project has been reviewed and approved by an independent research ethics committee, IRSID 314796. The project is funded by the National Institute for Health and Care Research, NIHR, Applied Research Collaboration National Priorities Programme for Adult Social Care and Social Work Award, Project ID ARC 271.